Healthy eating doesn't always require expensive ingredients or complicated recipes. Sometimes, the answer is already sitting in the freezer section of your grocery store. Today, we'll look at this simple 4-vegetable medley and ask, how good is it? And how does this common food fit into the structured meal? Let's deconstruct the medley's architecture. Carrots are diced to a precise size for uniform thermal penetration. Green beans provide essential structural insoluble fiber. Sweet corn contributes to the high total water mass. Green peas have a high botanical protein concentration, often preserved in a zero-added salt medium. The macro blueprint highlights high volume and low density. A 1-cup serving offers 60 to 75 kilocalories. The base metric is 86.7% water, mainly from sweet corn, maximizing gastric stretch and satiety with minimal caloric penalty. It provides 10 to 15 grams of carbohydrates and 2 to 5.6 grams of dietary fiber. We see a systemic targeting of the pigment physiology connection. Yellow and orange pigments from corn and carrots contain compounds like lutein and beta-carotene, supporting rhodopsin synthesis for night vision and blue light filtering. Green pigments from peas and beans contain vitamin K and magnesium, essential for bone health and preventing arterial calcification. The medley offers a 3-part glucose defense, despite starchy ingredients, maintaining a low glycemic index of 40 to 50. This involves the viscous fiber barrier, the slow-digesting amylose architecture, and phytochemical sensitization, which improves insulin sensitivity and reduces oxidative stress. Examining the glycemic matrix shows that while some individual components like boiled sweet corn have a higher glycemic index, the mixed cooked medley demonstrates synergy. The combination results in a low and stable glycemic load and index, specifically 45 to 55 for the index and 5 to 8 for the load per full cup. The food order effect uses timing as an intervention. The protocol suggests consuming the medley before eating starchy main carbohydrates. This establishes the fibrous gel matrix, reducing postprandial glucose peaks by 20% to 30% and minimizing insulin demand in type 2 diabetics. Prescribing the portion involves the starch calculus. Corn and peas are treated like starches. For a diabetic prescription, 1 cup cooked equals 1 starch choice, or 15 grams of carbohydrates. The plate geometry suggests filling half the plate with non-starchy vegetables, a quarter with the medley, and the final quarter with lean protein. The cryogenic advantage highlights preservation physics. The fresh fallacy shows nutrient degradation post-harvest. The frozen superiority uses standardized flash freezing to lock in peak ripeness, with a brief blanching process. This logistical edge eliminates seasonal cost fluctuations and provides year-round nutrient density. Thermodynamics favor the steaming protocol over boiling. Boiling causes rapid leaching of water-soluble vitamins. Steaming, especially in a microwave with minimal water, utilizes the innate moisture and preserves up to 90% of water-soluble nutrients, ensuring the cellular matrix remains intact. The lipid key is necessary for activating fat-soluble vitamins. Carotenoids and vitamin K require a lipid source for proper intestinal absorption. Pairing the medley with a healthy lipid like extra virgin olive oil, real butter, or avocado significantly boosts bioavailability and absorption efficiency. Flavor architecture enhances the profile without sacrificing nutrients. Use a savory broth sauté by simmering instead of boiling to reduce the broth to a rich layer. Utilize a spice matrix, from classic to complex. Apply finishing garnishes like fresh garlic and lemon juice immediately before serving to preserve volatile aromatic oils. Integrate the medley into meals like a Mexican-style sauté for diverse textures and complex flavors. For savory rice and grain bowls, toss the medley directly with rice or quinoa. In one-pot curries and stews, fold the frozen medley in only during the last 5 minutes. The ramen upgrade creates an instant, nutrient-dense meal. In master synthesis, prescribe 1 cup cooked per serving before primary starches to flatten glucose spikes. Prepare by buying frozen and steaming or microwaving, never boiling. Finally, pair the medley with a healthy lipid and elevate the flavor with broth glazing and fresh aromatic garnishes. This video is intended for educational and informational purposes only. It is not medical advice and should not be used as a substitute for professional medical consultation, diagnosis, or treatment. All material was carefully reviewed and curated with due diligence. However, medical knowledge, scientific evidence, and clinical recommendations continue to evolve. As a result, some information may change over time and may not reflect the most current evidence or guidelines at the time you view this video. Always consult a qualified healthcare professional regarding any medical concerns or before making decisions related to your health.